Perfect. So, welcome to our first Nurse Digest session of 2025. Welcome back if you have attended one of these sessions before. If you're new, welcome. We're really excited to have you on board. So, today's session, we will be discussing digital health in a RACH, improving the resident transfer experience. I'm joined with quite a few people. So, firstly, I'm Alicia, I'm the project officer of this project, and along with Cressida Bradley, who's the project manager. I'm then followed by, we've got from the Digital Health Agency, Anne Kubiak. She is the Senior Project Officer supporting Australia's Digital Health Agency Aged Care Education and Training Team. Anne's also a registered nurse and an environmental scientist, so she champions healthy communities as her primary goal. She's also supported by Mara Osman. She's the project manager. And we've also got the wonderful Sherry Lee, who's our 2025 ADHA Nurse Transformers. We've got a couple of other people, so we've also got Jeff Mitchell and Suzanne Manning from the Digital Health Agency joining us today. So before we begin, I'm just going to do an acknowledgement. So I'm just going to acknowledge APNA and the Digital Health Agency recognises the traditional custodians of land and sea on whose lands we work and live. We wish to pay our respects to all traditional owners and elders past and present and those emerging. And just some housekeeping today. So during this session, I'll be passing over Anne to provide you with all the content. You will notice that everyone, just the presenters are on speaker. You'll have a Q&A function as well. So the Q&A function is when you have any questions, please put them in. There's a few of us moderating the chat. And we will also be providing the slides and the recording after the session. So it is recorded and you'll have an opportunity to review and reflect on the content shared with you today. I'll hand over to you now, Anne.
Thanks, Alicia. And welcome everyone today, and thank you for joining the Australian Primary Care Nurses Association webinar today. Thank you to Alicia. Yes, I am Anne Kubiak, and today we'll be exploring how primary care nurses such as yourselves can contribute to improving a resident care transfer within an aged care setting with the implementation of digital health with My Health Record. Now, a session overview today will provide a general overview of My Health Record with an example of how to enact a residential care transfer. We will discuss real-world aged care challenges with incomplete clinical information and how challenging this can be within a setting. We'll also demonstrate how My Health Record can support nurses with workflow efficiency that enhances safety and quality in care. I'll then present a case study. It's a scenario that's quite relevant to nurses in aged care, which is also applicable across other primary care settings. This case study presents an opportunity for our primary care nurse, Sherry, to respond to several questions throughout this presentation as an interactive learning opportunity, quite similar to a Hear One, See One and Do One process. Today's learning objectives, we will be supporting primary care nurses to identify the sources of information contributing to My Health Record and how it can improve the sharing of health information. We'll support you to be able to describe the practical use of My Health Record and its application within a primary care setting, and explain the purpose of the residential care transfer summary and the documents within My Health Record and how they can enhance the transitions of care. So I wonder how many of you within your workplace have actually been exposed to My Health Record. We'll be popping in a poll in the chat now so we can get a bit more of an understanding of My Health Record within your workplace. If you could fill that out, thank you. So what is My Health Record? My Health Record is a summary of an individual's key information. It's personally controlled, which is a key element of the system. What this means is the individual has access to what gets uploaded, what stays in their record, and who can see their record. Importantly, My Health Record is part of a national system, which means that the individual's My Health Record travels with them wherever they are, and no matter which registered healthcare provider they're seeing. My Health Record is accessible at all times, including at the point of care by the patient and their representatives, and healthcare providers who are also involved in their care. It can be viewed and added to. However, this is subject to access controls set by the patient. My health record is private, it's protected via legislation, it's secure through multiple layers of international best practice IT security, and we have a team that monitors, maintains, and improves the system 24 hours a day. Some of you may be aware of my health record uptake within your organisation and the many sources of information that can be uploaded. On this slide, you can see there's a list of available documents, including healthcare provider documents on the left-hand side of the slide. There is also consumer-entered information uploads, Medicare information, and other documents shared with my health record. For today's session, we'll be focusing on the residential care transfer summary and the various documents required to enact a residential care transfer in just a moment. In addition to the individual documents, my health record provides high-level consolidated views, which are called overviews, and they show all aspects of health information which are accessible by both consumers and healthcare providers. And this also includes the new residential care transfer overview. We are now going to discuss our case study. This is Caleb's healthcare journey, and this case study involves a Q&A session with our primary health nurse, Sherry. During the interview, we will be identifying some key issues that nurses may face within a clinical setting. We'll discuss the care transfer summary documents to support a safe transfer and identify additional information that may be necessary to enact comprehensive and improved care for residents in aged care. So Caleb is an 86-year-old resident at Mornington Residential Aged Care Home who has shown signs of clinical deterioration since the 17th of June 2025. On the 18th of June, his general practitioner assessed his condition and found an increased blood pressure of 180/120, elevated pulse of 100 beats per minute, and shortness of breath with a respiratory rate of 28 breaths per minute. Oxygen was applied and immediate transfer was deemed necessary for urgent hospital treatment. Despite the urgency of the situation, nurses at times can be really faced with distressing and issues related to resident decline due to many factors. So I'm now going to ask Sherry. Sherry, what do you think could be the biggest challenges nurses face when coordinating the transfer of an aged care resident such as Caleb?
Hi, and thanks for the question. So from my experience regarding to this kind of urgent transfer situation, the biggest challenging will be we unable to get the documents, include everything to provide to the ambulance officers when they transfer the resident from aged care to the hospital. So incomplete documentation is one big challenging for us. And sometimes because most of the aged care we use electronic system, and some document information might missing or might because internet connection issue, we weren't able to get everything ready within a short time. That will be another challenging. And at the same time, the patient is deteriorated. As a nurse, we worried with stress of our patient. And also we need to print hard copy. That's another thing, because so many systems require to work together to get the paperwork ready, the transfer paperwork ready for the residents. So this will be challenging for the situation. My health record definitely was smoothest, less stress for everyone. When we provide a transfer patient to the hospital, it will be benefits because it includes a medication chart, which current medications patient or residents currently taking, and what's the past pathology results, image reports, or any medical conditions. So we can be peace of mind. Another thing, last thing we experienced, yes, we passed the paper, the transfer letter to the ambulance officer, and they might left the paper in the emergency, in the ambulance car. And the emergency department doctors or nurse often call us back. What's your patient current, resident's current situation? Then we're going to repeat the story, the information again. that's going to waste everyone's time and impact on patients' treatment plan.
No, thank you for providing those answers. It's very true. There are a lot of challenges in aged care in relation to a transfer and incomplete documentation. So the absence of immediate access to this comprehensive documentation that Sherry's talking about can really result in delays or inefficiencies in care for Caleb. So by addressing these gaps with My Health Record integration, healthcare providers can instantly retrieve digitally uploaded information. So immediate access to information can really support informed and efficient decision making in clinical settings, ultimately improving patient care. We will now take a look at the residential care transfer documents within My Health Record. This is one example of an overview and can vary between aged care settings. Within this slide, you will see on the right, there are three main documents that make up the residential care transfer summary document. So information is pulled from all documents and consolidated in the overview to really easily see everything in one view. And on the left, you can see the blue hyperlinks, which can also take you to the original source document. So the residential care transfer reason document captures the initial reason for the transfer in relation to this episode for Caleb, and it must be uploaded to trigger the creation of the residential care transfer overview in My Health Record. The residential care health summary document is also recommended to be uploaded with the transfer reason document. However, this can be uploaded at a later stage during an emergency event. And contents will be dependent on what is captured in the local clinical information system that's used. The residential care medication chart document, this is recommended also to be uploaded with the transfer reason document, but also can be uploaded at a later stage in the case of an emergency transfer. So currently, aged care software vendors are working closely with the Australian Digital Health Agency to reconfigure their clinical management systems to integrate directly with My Health Record, which will support the development of the residential care transfer summary. So as mentioned, this is actually a slide, is an overview, and the process can differ between aged care software vendors and aged care homes. But recently I actually saw a software demonstration from a particular vendor who demonstrated this process, and it looked pretty seamless and easy to understand. So we've talked about the residential care transfer overview and the associated documents view. However, there are other shared health information already existing in My Health Record, which includes an advanced care plan, which can be uploaded to an individual's health record either by the individual or by their custodian. An advanced care document custodian is actually a person responsible for holding a copy of the advanced care document and making it available to healthcare providers when required. The goals of care document, which is generally a medical or episodic document prepared by a healthcare professional that reflects a shared decision-making process with the patient, their family and or carers, and some other shared information such as immunisation, discharge summaries, and shared health summaries. So we'll now discuss advanced care planning for Caleb. So Sherry, when organising a transfer for Caleb, what additional information do you feel is important to inform his care?
The additional information regarding this case study, I think the current vital signs, what's the current blood pressure, pulse, respiration rate. I think according to the information you provided before, his blood pressure elevated, which is one of the key things we need to provide to patient, to provide to the ambulance officer and the future hospital doctor, so they can have a better understanding. And also the also the pulse and the respiration rate, all sort of the vital signs. This definitely going to benefit for Keller have the immediately or future more appropriate care.
So do you think it would be important for, in relation to deteriorating patient in aged care, to understand what their wishes might look like in relation to ensuring they have an advanced care plan?
Yeah, regarding to advanced care plan, yeah, That's definitely what they wish is NFR, DNR, or they wish to commence the proper treatment, or in case if they need intubate or CPR or anything related with that. Yeah, it definitely will be more streamlined and less repeatable questions to them, to family members.
No, it is important to have that information to inform his care should he not be able to communicate his wishes in such a situation. So advanced care planning is very important, and it ensures a person's future medical care and includes their wishes and preferences should they become seriously ill and unable to communicate regarding their treatment decisions, particularly in relation to this case study. So the advanced care plan can be uploaded to an individual's My Health record by either the individual themselves or by their substitute decision maker. Healthcare providers have some software capability to upload advanced care planning information on the person's behalf to their My Health record as well. A substitute decision maker may be legally appointed to make medical decisions on a person's behalf, and family and carers can access and update care preferences within My Health record, and these are known as authorised and nominated representatives. So an authorised representative is a person who has parental responsibility, legal authority, or otherwise appropriate to act on an individual's behalf if they're unable to make their own decisions. So in the context of aged care, the authorised representative is typically a carer, a family member, legal guardian, or somebody with enduring power of attorney. An authorised representative has complete access to control over the record as if it was their own. An authorised representative must make reasonable efforts to identify and support the will and preferences of the person they're representing. A nominated representative is a person who has capacity to invite a person to become their representative, and it's usually someone they can trust. So having a nominated representative is especially useful for older people who require assistance, people who may have a disability, and people who speak English as a second language. The person or the authorised representative has complete control and can choose the type of access level available to the nominated representative. The nominated representative cannot authorise another person to have access or change the access level in My Health record. There is no limit to the amount of nominated representatives a person can have. So very important to understand the representatives that can support Caleb in his healthcare journey and ensure that his wishes are catered for should he decline. So I'm now going to head back over to Sherry. So Sherry, based on our case study today and the residential care transfer, how might My Health record enhance resident care safety and overall quality in aged care?
Thank you. And first of all, I think it's a comprehensive medical data. So the treatment plan can be more consistency and align with the advanced care plan for the residents. And the family member will be more stress-free, less stress in that situation. And also our patient will receive the efficient care according to their wish. And this is also aligned with the patient-centered care and streamline time consumed. Yeah.
Thanks, Sherry. Yes, no, I think if My Health Care was accessible for all people in My Health Record, is accessible for all people in aged care, I think perhaps the medication management process may be better as well. It would potentially support fewer prescribing errors and reduce risk in aged care. And as you said, Sherry, I think having a complete patient history makes a huge difference to help make those really quick and safer decisions. Less duplication could also be a plus. So no need for repetition in testing. And I think most importantly too, I think it might or may empower both residents and healthcare teams. So when everyone has the right information at the right time, it can really lead to better quality care and outcomes. Thank you, Sherry. So My Health Record is a great digital tool containing a range of information that can support clinicians and add value to clinical practice. It provides a greater understanding and visibility between healthcare providers involved in the care of a person. It enhances continuity of care and capacity to better coordinate particularly in the case of a resident transfer to hospital. So digital health is no longer an option. It is essential. Nurses are invited to help drive digital health adoption in primary care settings. And you can really play a crucial role in championing digital health integration into your daily practice. So we really welcome your support with digital uplift in residential aged care settings. Now, the Australian Digital Health Association provides free training modules for clinical staff in primary care. And we are currently working with aged care providers across Australia to register My Health record within their organisation. Currently, we've achieved around 43% of adoption now, but we still have a bit of a long way to go. And this is a project to drive adoption within the agency. It's headed up by Marwa, who's also in the webinar today. Thank you, everyone. Please contact the ADHA for further information on My Health record. And we'll also be forwarding the slides for distribution across your network. And there'll also be an inclusion of additional slides that were not viewed today just to support your understanding.
Thank you so much, Anne. Thank you for attending. We haven't had any questions in the chat, so as we have finished a couple minutes early, I have launched an evaluation poll, and we really do encourage you to complete these just to provide us some feedback and let us know if this is helping. And I wanted to just thank Sherry as well for that interview kind of component. It really kind of consolidated everything on the ground that Anne was speaking about today. I still haven't had any questions. We will be hosting another Nurse Digest session in September. So if you are wanting to participate in our next session, it is in September. And we also have the QR code. So that's our mailing list. So if you're wanting to be kept up to date, scan that QR code on your phones if you have it handy, and we will be in contact when we've finalized a date.
Thank you, Alicia. Thank you, Anne.
Thanks, Sherry. It was really
Thank you, Sherry.
Thanks for such the enriching answers as well. You really led them so well.
Oh, thank you. Okay. Bye.
Thank you, Alicia, for hosting.
Thanks, Jeff.
Thank you, Anne, and thank you, Sherry.
Thank you, Jeff.
All right. Well, if we have no other questions, we've had some lovely feedback in the chat, so thank you so much from everyone. I'm going to give you 5 minutes back. If anyone has any last minute questions, please let us know.
That's all I'm saying.
All right, take care, everyone, and thanks for joining, and enjoy the rest of your lunch break.
Thank you very much. See you soon.
Thank you.